Shah, Pro-Chancellor, Symbiosis International University, and the Principal Director of Symbiosis Society, Dr. Rajiv Yarvadekarji, the Provost Faculty of Medical and Health Sciences, Symbiosis International University, Dr. T. Vidyasagarji, the Dean of Symbiosis Medical College for Women, Madam Sanjeevani Majumdarji, the faculty members, distinguished guests, dear students, and friends from the media, print media and electronic media. It is indeed an honor and privilege for me to be here this afternoon for the inauguration of the Center of Urology and Nephrology, and also the great work being done in the Symbiosis Center for Health Research. It is a momentous occasion when the Symbiosis International University, which is working hard, and really it has benefited the community at large. So I feel proud and privileged to be here this afternoon. At the very outset, as we started this program with the remembering of the martyrs the sad incident which took place 4 days back in Pahalgam, we paid homage to them. We and all condemn this cowardly and inhuman act which took place 4 days back. But at the same time, I would like to assure, as the Honorable Prime Minister has said in very hard terms, that you will be given a befitting answer beyond your you'll be given a befitting answer beyond your imagination. And that there is a lot of expectation, hope, and people are really disturbed about the incident. And all of us share about that. As Dr. Rajiv showed the video, so now nothing for me to explain. But it is the factual which happened that in 2017 I came. It was for one of the conferences that I participated. And that point of time I tried to know that Symbiosis is doing a lot more of work in various faculties and is an institute which is developing itself in various disciplines. So I asked Dr. Majumdar that why not think of the medical faculty and medical institution and medical school to be opened. He was fair and frank to say that the regulatory systems are not conducive, and so the regulatory system needs to be changed. And as we know that Prime Minister Modi is a man of action, dedication, and commitment. So I, on his behalf, gave the commitment that the regulatory system will be changed. And after a year and a half, in my first tenure itself, the regulatory system got changed. And I came to know that now Dr. Majumdar has planned to start a medical college, medical school. So I'm really very thankful to him, grateful to him that he accepted my request, and he was sincere to the core when he meant that he is committed for medical education, but the handicaps which one has to face. So the government of India tried to remove those handicaps, and today we see not only a medical college, but a pioneer institution in the field of medical education. I really congratulate to come here. I'm also very happy to note that this college is dedicated to the women. This is very special and very important part. For this also I give Dr. Majumdar, Madam Vidya and Rajiv and Mrs. Majumdar great appreciation that you have dedicated this institute for the cause of the women, nothing more can be better for the women empowerment which you have tried to enunciate here through this medical school. We all know that when we talk about nephrology, urology, and as Dr. Majumdar has said that in coming times he is going to, when he says, I take it as a textbook which is going to be followed. So today it is a center, tomorrow it will be an institute of urology and nephrology. That is because he has set the roadmap for Vidyaji and Rajivji, and I hope you all are going to fulfill it in that very letter and spirit. But yes, we all know that NCDs are on an increase, and when non-communicable diseases are on an increase, departments like nephrology, urology are needed. And if you have a center of excellence like for these disciplines, certainly it's going to really help to the people at large. I'm also happy to note that your symbiosis community approach, reaching them scope, which you have started, and you have selected some 35 villages where you have tried to see that each and every person living in those villages, you have a data of each individual and of every family. And this is how you are trying to see to it that how not only symbiosis grows, but the whole area, the health-wise and other occupation-wise, and also giving them employment, giving them training, skilling them, upgrading them. It's a really a very appreciable move. And when Dr. Majumdar talks about Vasudhaiv Kutumbakam, you are certainly doing that Vasudhaiv Kutumbakam, but you are also taking care of your neighbors. This is what has to be much more appreciated. तो कुटुंब तो है ही पूरा, लेकिन कुटुंब में पड़ोसी भी अपने साथ है, उसको आपने जोड़ने का प्रयास किया है, ये बहुत अच्छी बात है. As far as I got the opportunity to visit the hospital, I could go to the cath lab, I could go to the various other departments. It is a state of the art where you have developed, and I can assure you that your whole program is in tune and in line with the government policies. So I also assure you that as far as dialysis is concerned, we will try to align you with the Pradhan Mantri Dialysis Yojana and see to it that how you can upscale it for the society and go forward in that direction. Here when I've come, again I'll say one thing, that it's not only, this institute is not only an institute of quality, of best standards, but the best part is that everything is free of cost. This is what we have to understand. This is not easy. This is not possible. But you have made it possible. So certainly, my appreciation to the Vidyaji, Rajivji, and of course Dr. Majumdar, whose vision has brought it to such a level. And to the students, I would like to suggest that sometimes we always say that education is our birthright, education is our birthright. I was also a student, a youth leader, used to say, education is our birthright. But professional education is not a birthright, it is a privilege which you are getting. And the privilege which you are getting, I would request you that you should keep that spirit alive, that you have to repay to the society in the best possible manner. And for that, the sanskaras which you are going to get here, the rich traditions you are being imbibed here, the high values which are being brought here, all this is going to make not only a good doctor, but also a good human being. That is what I understand. And I have got full confidence and hope in you that in coming times you will be serving the society and not only keeping your name, giving your name to yourself, but also to the institute from where you have undergone the training. Another thing which I would like to say is that you should always keep in mind that whoever has played an important role in making yourself, your parents, your teachers, your helpers. When I was a student, I used to ask my mess boy that wake me up at 5 o'clock and give me a black coffee. Even he has participated in my baking. So it is which we have to understand. But how a personality grows, how a personality makes. So the students should remember that the people, the friends, the helpers, the teachers, the parents, how much they have put in you. Because of that, you are what you are. So that aspect should also be kept in mind. I'm very happy to note that the Institute is working in line with the policies of the Government of India. When I say so, we have to understand that before 2017, we had a policy of health which was, I would like to say, it was working in silos. And it was a policy which took care of the curative part. हमने इतने हॉस्पिटल्स बना दिए, हमने इतने dispensaries बना दी, हमने इतने institutes बना दिए. All this was a curative part. In 2017, we came out with a policy which was inclusive, holistic, which had the preventive part, the promotive part, the curative part, the palliative part, the rehabilitative part, the geriatric part, so that from the first breath of any individual till the last breath, we take care of it. And another thing is that we should prevent from bringing a patient to the curative part. We should go for a promotive health care. And your community outreach is an example which is doing a very wonderful job in preventive part and in promotive part. And the students also get an opportunity and an exposure how they can be of use, they can see that how a patient converts himself to be an NCD patient. And so you are able to prevent at the right moment. And government has started some 175,000 Ayushman Arogya Mandir. And these Ayushman Arogya Mandir are now having, we are going forward in that direction, that we will be having at the age of 30, a compulsory screening of hypertension, diabetes, cervix cancer for ladies, breast cancer for ladies, and oral cancer for both men and women, and also dental care and mental care. And we will be referring patients accordingly. And it is in more than 100 million people have been screened for this, and more than thousands of them have been detected for cancer, for cervix cancer, for breast cancer, for oral cancer, and they have been rightly treated. And you will be happy to note that there is an article in Lancet 3 months back, when they say so, that in India, because of Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, and because of increasing the baseline of the detection, 90% of the cancer patients, the treatment starts from the detection. Within 30 days, the treatment starts. So this has been possible how? It has been possible because we have increased the baseline, and the screening has been proactive, and there is a follow-up action where in the Pradhan Mantri Jan Arogya Yojana, he is given the facility to get himself treated. So this is how we are trying to make India healthier. And the day we are also going for an NQAS. All these 175,000 Ayushman Arogya Mandir have to fulfill the NQAS standards. NQAS is National Quality Assessment Standards. That has to be followed. And I would like to share with you that 30,000 Ayushman Arogya Mandir are now having NQAS standards. But we are not happy, we are not satisfied. We want to make it 175,000. All Ayushman Arogya Mandir should have NQAS standards. That is how we are working. We have done good, as Dr. Rajiv explained, that now more than 780 medical colleges have come up, more than 1,15,000 UG seats are there, more than 50,000 plus PG seats are there. But we are not satisfied. In the next 5 years, we are going to increase UG, PG seats to the tune of 75,000 plus we will be having. We want to make it. एक समय था लोग बोलते थे ब्रेन ड्रेन हो रहा है, हमारे यहाँ पढ़ते हैं और चले जाते हैं. मैं उस समय भी कहता था थिंक पॉजिटिव. अरे हम दुनिया को दे रहे हैं, हम देने वाले हैं, हम देंगे, उनको भी देंगे, लेकिन हम भारत को भी खाली नहीं छोड़ेंगे. भारत के लिए भी हम माकूल डॉक्टर्स देंगे. दिस इज अवर स्पिरिट जिसके साथ हम काम कर रहे हैं. एंड दैट इज व्हाई वी हैव सेड, and we are not talking only about doctors, we are talking about paramedics also. Each hospital will have a nursing school co-located with the hospital. So ये इस तरीके से हम डेवलप करने की कोशिश कर रहे हैं. और उसमें institutions like Symbiosis is a leader in itself. We should think, Vidyaji, we should think how we can go hand in hand, how your institute and the government institutes can help together and in policy making, in implementation, in public-private partnership. All this is going to help. So we can design new programs accordingly. But this is the only, for future, ये silos में हमने नहीं बांटना है. We have to expand and we have to keep an open mind, because we have to do in a short span of time that in medical education, India is the pioneer. That is what we have to do. You will be happy to note that you will be surprised to note, and you will be also happy to note that by the end of last century, we had only one All India Institute of Medical Sciences. Only one since independence. And then Atal Bihari Vajpayee ji opened 6 All India Institute of Medical Sciences. And in the past 10 years, Prime Minister Modi has opened 16 new All India Institute of Medical Sciences. A big leap. Now we have got 22 All India Institute of Medical Sciences. And they are all state of the art. State of the art. When I was a student, I used to say कि आप बाहर क्यों जाते हो, अमेरिका क्यों जा रहे हो? So they used to say that we don't have facilities here. And they were correct to say that. But today, we have the best facilities. And best facilities not only in government sector, but in private sector also. And Symbiosis is an example, where we have got the best facilities. Your Arogya Dham, your research center, the areas which you are covering up, that itself shows that what new areas of life sciences you have chosen for health research, and your interaction with the industry and with academia itself is going to make a lot of difference. So what I feel is that coming times is and as Dr. Majumdar said, that the 21st century belongs to India. Certainly it belongs to India. We have to go a long way, and we will be successful in that. Once again, I thank Dr. Majumdar, Vidyaji, Rajivji, Mrs. Majumdar for giving me an opportunity to be here and to be part and parcel of this inauguration of Center for Urology and Nephrology, and got an opportunity to interact with the young minds who are all set for doing their best in their life. My good wishes to them, my best wishes to them. Have a prosperous life. Dedicate yourself for the humanity. Thank you very much for giving me a patient hearing.